Dr. Emmer and Dr. Rojas, we are live.
Hey guys, it's Dr. Emmer, Dr.
Dr.
Rojas.
Yes.
We are here post-surgery from yesterday, very excited for our beautiful patient. She had a previous facelift and had some acne scarring, some textural issues to her face that she really wanted to get improved. So I said, you know what? We need to bring in Dr. Rojas, expert in both body and facial plastics, to do this revision facelift. And we had to bring me in to do the acne scars and the textural improvement, because the combination always gives an even better result. And I want to show you guys something, because this is just astounding, this result. So we see our patient here, obviously, you know, has a lot of laxity here. You can see scar from a previous surgery. You see the neck bands. But now look at her neck. Dr. Ross, tell them what you did.
So we combined with the neck lift and the facing a platysmoplasty, where we tighten the muscle, the neck muscle right here. And we talked about it yesterday, giving it a more acute 90-degree angle.
Those were the lines she had. And now you guys can see, look,
Exactly.
there is none.
So we do liposuction, we do the platysmoplasty, and we top it off with a combination of J-plasma and Morpheus 8 during the case, same case, for optimal results.
And the reason why this is so good is that RENUVION, when it goes under the skin, that plasma contracts the tissue and gets rid of a lot of bruising. And if you take a look, she really is not bruised.
For the
It's
amount.
just, for the amount of work that was done. It's a lot of swelling and a lot of scabbing from the laser. You guys could see all the laser marks, but it's not so bad for the actual surgical part. Most people would have a lot of bruising around their eyes, some swelling there, and the neck, but he did that
The
RENUVION.
ANTEAGE also helps with the healing and the
All the
swelling.
skincare, the Emmer skin products, the ANTEAGE stem cell, and then we also applied exosomes, ANTEAGE exosomes to help her heal, which is why I think she's not as swollen around her eyes,
Correct.
as well as the neck. And you guys can also see, we can go all the way up to the scar, and this is very important. If you see this scar is placed right on the tragus, all the way up, directly connecting to the ear, and she doesn't have any pixie ear deformity. There's no issue, it connects perfectly. But here before, you guys could see telltale sign that a surgery was performed because the scar was improperly placed. So just placing this properly in the excision and going all the way back, the flap extending all the way into the hairline, we extend the laser all the way back too, and that allows us to get an even better result for her. Now the key question is, how do you feel?
Yes, how do you feel?
I feel fantastic. I have no pain. This has been a real pleasure to have these guys work on me, and very, very helpful. The whole office staff, the physicians, it's wonderful. I feel great.
So that's the key, because to me, I don't want people to feel like we tortured them, like they're in a lot of pain. We're definitely here for them for sure over the next couple weeks as she heals, and then my goal is I get lots of selfies starting from 2 weeks on for the next year, showing me how good she looks.
And my philosophy is just we are a team, we are a family, we want the best for you, and we want to transmit that energy to our patients.
And some of the things we also did in combination that I really want you guys to know about is we did fat grafting, and we also did subcision with SCULPTRA and RENUVA. RENUVA is a synthetic adipose tissue matrix. It basically tells your body to produce its own fat, and the SCULPTRA tells your body to produce its own collagen. So in the areas of her cheek area, temple, I actually did some in the eyebrow. You can't see it right now because she's swollen. Around the mouth and folds and on her chin. We did all of those areas with what we call volume restoration and regenerative medicine. So the lift itself will look good because it will tighten, but if you don't replace that lost volume that you get with aging, stress, hormone changes, etc., you don't see the same results. And I want to show you guys a little bit on her before. One of the reasons her folds were really heavy and she saw a lot of these scars was because she had a lot of volume loss through here, through this area too. And if you look at her chin even right now, I'll show you guys from the other angle. Hold on. If you guys see here, her chin was a little weaker. You see how it came back, but behind her lip. But now if you come forward, take a look at the chin. Much more projected. You guys see that there? It's projected because we added fat to the chin. So this is really going to be those subtle things that you don't notice that a surgeon does, but this is what gives the full comprehensive result, and it's why we give an even better result. So I'm very excited for this. I want to get that head wrap back on so it doesn't swell too much. But take a look. I mean, overall, full face, neck, and eyes, all treated. Revision on the neck, which now has that perfect angle on her jawline and her chin. And then you can see again, the sutures being placed perfectly in line where they should be, and no issues noted, at least at day 1, when it was the most critical time. The first 3 days, making sure that there's no issues, and we're gonna do aggressive skincare on her to make sure she heals really rapidly, and you guys will see that over the next week to 2 weeks. Anything else you want to say, Dr. Rojas?
No, we're going to use it. We're going to remove the drains today. The technical components of what happens in the recovery. Today, we get rid of the drains, which is just day 1. Minimal output expected for the first night, and then she'll continue to protect the incisions with all our skincare.
Yeah, that's it. So do a quick pan, show everyone how she looks. Super happy, you guys, that this is anticipated, and we're going to see an even bigger smile at week 1.